Hello my dear, this is the video on sickle cell anemia. I have made this video, this content from the textbook of medicine, the Davidson, and the help from the MRCP note by Sharma. And here is the here is the question number 69 and 263. You can go through this question. The most important point are noted here. At first, it is autosomal recessive. You know, it is autosomal recessive. At first, you have to know this. And when it is homozygous, that is hemoglobin SS, then it is called sickle cell anemia. But when it is heterozygous, then it is not sickle cell anemia. Rather, it can be called sickle cell disease. And the sickle cell anemia patient actually present as anemia, hemolysis, etc. But trait form of sickle cell anemia or sickle cell disease, that is trait, are not actually anemic. They are actually remain asymptomatic lifelong or very unusually mildly anemic. So in trait form, they can be hemoglobin SC, that is the hemoglobin SS, that is in homozygous state, both the globin chain are defective. But in trait form, the one hemoglobin chain is defective for S and other will be defective either C, hemoglobin C, or beta thalassemia trait. So however, there sickle cell trait, in sickle cell trait only one abnormal globin chain. It is mostly prevalent in the Africa, Middle East, and somewhat little bit in our India. Everything is not bad here. A sickle cell anemic patient, either homozygous or heterozygous, they give protection against malaria. Malaria is very endemic or prevalent in Africa, and also in Africa, sickle cell anemia patients are very much prevalent. The question in exam, what will be the PVF finding in sickle cell anemia? High reticulocyte count because of hemolysis, some target cell, polychromasia. Polychromasia is actually due to high reticulocyte count, as well as immature RBC in the peripheral blood film, and of course the sickle cell like this, sickle cell like this. Okay. Now, after getting the report of PBA, what will be the next important investigation to reach the diagnosis? The number one, the most important diagnostic investigation is hemoglobin electrophoresis, and of course the family screening. As it is autosomal recessive, so the both parent will be affected. Either they will be carrier or they will be affected. Now the most important question meet in exam, the crisis. What are the crises with which the sickle cell anemia patient can present through emergency department? The number one, the thrombotic crisis, such as hand-foot syndrome. The hand-foot syndrome patient present as dactylitis, severe pain on the hand, finger or toe, abdominal pain due to mesenteric infarction or pulmonary infarction or stroke, ischemic stroke. So this is the number one, the thrombotic crisis. Number two, the hemolytic crisis, in sudden severe intravascular hemolysis. Then aplastic crisis. Actually, aplastic crisis is precipitated by parvovirus B19, as because we know the parvovirus B19 itself can cause red cell aplasia. And then the most important, the sequestration crisis. Sequestration may occur in any solid organ, most importantly spleen, liver and also kidney. And these frequent sequestration in the spleen can lead to asplenic condition, that or hyposplenic condition. Then the autosplenic infarction, already I said, these are not crises. Crises are thrombotic crisis, hemolytic crisis, aplastic crisis, and sequestration crisis. Now, the Autosplenic infarction, how does it occur? Frequent infarction or sequestration inside the spleen lead to hyposplenic condition, and that hyposplenic condition is responsible for the infection by capsulated organism like meningococcemia বা meningococcal bacteria. Number 1, the Haemophilus influenzae, Streptococcus pneumoniae, and Neisseria meningitidis. So these 3 important organisms. And a low-grade hemolysis, chronic low-grade hemolysis can lead to pigment gallstone. Now, as a whole, what are the complication of sickle cell anemia? Already said, hand-foot syndrome, painful bone crisis, aplastic crisis, sequestration crisis, pulmonary syndrome like thrombotic or sequestration, stroke, infection, gallstone, pigment formation. These are the list of complications may occur in a patient with sickle cell anemia. And progressive renal failure, it is due to actually papillary necrosis due to intrarenal thrombosis or infarction, and it leads to inability to concentrate urine. Chronic leg ulcer, very important topic for auscultation. Priapism, painful erection of penis. AVN of head of the femur. AVN means avascular necrosis of head of the femur due to thrombosis, and Salmonella osteomyelitis. Okay. Next question is how will you manage the patient with presenting as crisis? Okay. The mnemonic is here for hope, hydration, oxygenation, pain relief by opioids, not NSAIDs, mind it, not NSAIDs. NSAIDs will not work here. You will have to give the opioids, and hyperbaric oxygenation, already said, and it may need antibiotic, if infection, evidence of infection is there. So this is all about. I think this will be very much helpful for the student, undergraduate and postgraduate student. So thank you very much.